Okay, welcome everybody. Good day to you. We're going to talk about the medical emergencies in the dental office. Management of medical emergencies. This includes 6 points. Number 1 is prevention. Number 2 is preparation. Number 3, recognition. Number 4 and 5, basic life support, BLS, cardiopulmonary resuscitation, CPR, and number 6, specific medical emergencies. But the best measure for you as a dentist is to know your patient and never treat a stranger. The prevention. We have to take a medical history and review and update the history each time, especially about the medication, because the patient maybe have started a new medication, a new anticoagulant, or others. Vital signs, the blood pressure, pulse, temperature, and respiratory rate. Physical examination is by visual inspection of patients. You may find any abnormality that draws your attention that there is a problem, like for example finger clubbing, like pallor, like cyanosis, and other symptoms that you may notice by your eyes. Determination of the medical risk, or the ASA classification. Stress reduction. This can prevent a lot of emergencies. This can be through pre-medication or sedation, pain control, intra and post-operative, early appointments, short appointments. The determination of the medical risk. The American Society of Anesthesiology, the ASA, has set the physical status classification system, and they have put 5 classes. ASA 1 is normal healthy patient without systemic disease. This patient can tolerate stress in dental treatment and there's no added risk. Dental treatment modification is not necessary. ASA 2, there's a mild systemic disease like well-controlled diabetes, well-controlled hypertension, well-controlled bronchial asthma, or a patient in class 1, the ASA 1, but having anxiety. Here there is a minimal risk during dental treatment and we need to do minor modifications like short appointments, antibiotic prophylaxis, or sedation. ASA 3 is a patient having severe systemic disease, limiting activity but not incapacitating, like stable angina, 6 months post myocardial infarction, or 6 months post cerebrovascular accidents, or COPD. Elective dental treatment is not contraindicated, but we need to do treatment modification like reducing stress, sedation, short appointments. ASA 4, there's an incapacitating systemic disease with a constant threat to life, like unstable angina, myocardial infarction within the first 6 months, cerebrovascular accident within the first 6 months, or if there is a very severe hypertension with a blood pressure over 200/115, or uncontrolled diabetes. Here we have to postpone the elective dental care. Only emergency dental care, which is to control the pain and give antibiotics for infection, and that's it. The final class, ASA 5, is a morbid patient not expected to survive for long. Example like end-stage renal disease, end-stage hepatic disease, terminal cancer, and end-stage infectious disease. Elective treatment is contraindicated. Only emergency dental care, and this should be done in hospital, like pain control. Preparation is the key, and this is a team effort. BLS course for all the office personnel, CPR course certification for all office personnel, and you have to have an emergency plan. Everybody in the office should know and should be assigned a role in this emergency plan so that when an emergency happens, everybody knows what to do. Emergency phone numbers should be around. Emergency equipment should be there in the office. And in the emergency plan, first of all, in dealing with emergency is to check the ABC. A is the airway, B the breathing, C the circulation. And accordingly, you are going to go ahead in your plan, whether the patient is conscious, breathing with a palpable pulse, or the other way around if he's unconscious and not breathing and no pulse. What is an emergency situation? Common emergency situations are fainting, vasovagal syncope, diabetic coma, anaphylactic shock, epileptic seizures, cardiovascular collapse, thyroid crisis, adrenal crisis, asthmatic attacks, bronchial asthma, stroke, cerebrovascular accident. And all these situations give three clinical pictures: either sudden loss of consciousness or collapse, chest pain and dyspnea, or convulsions. These are the clinical presentation of emergencies: either collapse, chest pain and dyspnea, convulsions, and fits. In collapse, the possible situation or the causes can be vasovagal syncope, hypoglycemia, anaphylactic shock, steroid crisis, myocardial infarction, cardiac arrest, or cerebrovascular accident. Chest pain or difficulty in breathing, dyspnea, the causes can be angina, myocardial infarction, bronchial asthma, anaphylactic shock. Convulsions, it can be due to epilepsy or due to any other cause of loss of consciousness, including simple fainting. Basic emergency procedures. In sudden loss of consciousness, we have to monitor the blood pressure and pulse. Check the airway, clear, secure, and maintain an open airway. Check the ABC, the airway, the breathing, the circulation. If there is no breathing, no circulation, you have to start cardiopulmonary resuscitation and put an intravenous cannulation. Fainting, the vasovagal syncope. The predisposing factors are the stress conditions, fear and anxiety, especially from the local anesthesia, pain, fatigue, and hunger. The mechanism: there is massive parasympathetic discharge leading to vasodilation with pooling of blood, bradycardia, and hypotension. Signs and symptoms: there is dizziness, there is pale, cold, moist skin. The pulse initially is slow and weak, and then it becomes full and bounding after recovery. The management: lay flat and lift the legs up. Loosen tight clothing around the neck. Apply cold towel to the forehead. Administer 100% oxygen. Sweet drink on regaining consciousness. Reassurance. Prevention: take a good history. Reassure the patient. General anxiety, stress reduction protocol. Well fed prior to treatment. Glucose drink. 10 milligrams diazepam knocked prior to the appointment and 1 hour before treatment. This is a pre-medication. And you may delay the procedure until the patient is reassured. Hyperventilation. The causes are acute anxiety attack, hypoglycemia, hyperthyroidism, Cushing's syndrome, pheochromocytoma. Signs and symptoms: tachypnea, tachycardia, sweating, paresthesia around the mouth and fingers, tetany cramps, nausea, and fainting. Treatment: those due to anxiety attacks, we assure the patient airway, reassure the patient, breathe in a paper bag. Anaphylactic reaction. The pathophysiology. Type 1 hypersensitivity reaction. It's an immediate hypersensitivity which involves IgE mediated release of histamine and other mediators for the mast cells and basophils. The histamine leads to widespread vasodilatation and increasing capillary permeability and potentially fatal hypotension. The quicker the onset, the more severe the reaction. Causes can be due to drugs, like penicillin anaphylaxis, insect stings, certain foods, nuts, and shellfish. Signs and symptoms are variable, very variable. Rapid weak pulse with falling blood pressure, pallor going on to cyanosis, facial flushing, itching, tingling, cold, sweaty skin, and sometimes urticaria, like in these pictures, facial edema, and maybe laryngeal edema, bronchospasm and wheezing, angina, dyspnea, loss of consciousness. Management. Lay the patient flat, raise his legs, or if in the dental chair you can put him in the head down position. Adrenaline is the life-saving agent in the concentration 1 to 2000, 0.5 milliliters, either subcutaneously or intramuscularly. Hydrocortisone 200 milligrams IV. Chlorpheniramine, which is an antihistamine, 10 to 20 milligrams slowly intravenously. Oxygen, cricothyrotomy if there is a laryngeal edema. Thank you very much.